Good morning and welcome to GPAT. I'm Sarah Taylor. I am the Manager of Marketing with ECU Health, Home Health and Hospice, and I serve on the Eastern North Carolina Fall Coalition. And today we have a guest speaker here. This is Dr. Anne Marie Nye, and she is a pharmacist. Can you share with our audience what you do and where you're located?
Yes, I work for Campbell University teaching in the pharmacy program there. Although I'm most commonly in Greenville, I work at the ECU Geriatric Monk Center as a clinical pharmacist there, and I have students in the last year of the program that rotate with me for 1 month at a time.
Awesome. And I know that you became involved with us at the Eastern North Carolina Fall Prevention Coalition, where we work to create awareness about falls in order to reduce the number of falls, the serious injuries, and even premature deaths. So today we are actually going to be hosting this show, and we have called it, How Do Medications Affect Your Balance? And so with that being said, I've got a list of questions for you today that I think would be very, very beneficial for our audience. Okay, so how can medications put people at risk for falls?
Medications, even though they have a lot of positive effects and goals to try to make us healthier, still sometimes have the rare chance of having side effects. And some of those can make people feel dizzy, lightheaded. They may feel really sleepy or tired, weak or confused. And with those kind of side effects, sometimes that puts a little bit of stress on people's balance, makes them a little bit less coordinated when they're trying to walk and do other things. And it may be more challenging to keep their footing. So we see some falls or also some slips or trips where sometimes people may be able to catch themselves.
Okay. So what over-the-counter medications could actually increase fall risks?
That is a good question, because a lot of times people are selecting their own over-the-counter products. What I would be most careful about are the older antihistamine medications. So I think of diphenhydramine, which is under brand name Benadryl, to be really careful with that. And it hides in so many different products. Similar medications are in a lot of the over-the-counter sleep products, in cough and cold medications, and sometimes in medications for flu. So if people are using an antihistamine, try to use some of the newer products. And fortunately, those tend to be more common that we see in some of the products in these categories.
Okay, that's good to know. So what types of medications are most likely to increase someone's risk of falls?
There's a variety of different types of medications. Unfortunately, quite a few of our mental health medications may increase the risk of falls. And this is certainly not a reason not to use them. It's just something that we really have to be cautious about. Anything that affects the brain or the nervous system, some of the strong pain medications or muscle relaxants may also put people at risk.
Okay. That is also good to know. But I would assume that if their doctor is prescribing this and they are experiencing some of these things, do they need to share that with their doctor?
Certainly, if you're experiencing any side effect that you find concerning, I would certainly recommend talking to your doctor about that. If you experience any lightheadedness, dizziness, as you start on a medication, as you change the dose of a medication, that would be the first thing I would do, is talk to the doctor. You can also ask your pharmacist, because you really need a healthcare professional to help you weigh the benefits of the medication, see how likely this new symptom is to be a side effect, and kind of think about, does the dose need to be adjusted? Is the benefit really worth the potential risk? And that's something we have to weigh individually, for every patient based on their circumstances.
Okay. All right. Very good. So why is it that sleep aids and anxiety medication make people unsteady?
These medications are designed to kind of calm you down, kind of slow the thinking, which helps with the relaxation for sleep and decrease nervous or anxious feelings. But at the same time, they slow other things as well, which includes coordination, balance. It may be a little bit, slowed in your reaction time, as far as steadying yourself or adjusting to things in the environment. So the beneficial effects, sometimes if we have too many of them, can lead to potential problems.
Okay, very good. So do you think that the older adults and population are more affected by these medications and increase the number of falls?
As we get older, we have a lot of changes, which sometimes your vision changes and isn't quite as good. There may be some different diseases that cause symptoms, so you're not feeling quite as well. So arthritis or some pains may make people move a little bit differently, and you put that together with the medications, and the body handles the medications differently with aging. They may last a little bit longer. Your body doesn't have quite as many coping mechanisms as when people are younger to kind of deal with some of the side effects of medications. So we see the older patients, have a higher chance of falls on some of the very same medications that younger to middle-aged adults may be less likely to have those problems.
Okay. I'm going to ask you to help me out with a definition here.
Okay.
I keep hearing this term polypharmacy. Polypharmacy. What does that mean?
I think of polypharmacy as having more medications than you personally need. I've seen a number of different definitions as far as a certain number, and we certainly become more concerned or want to think more carefully about the importance of each medication as the number gets higher. So that's one of the things I think is really important as a pharmacist working with older people, is to make sure that they still have a reason to be on each and every medication that they're on, trying to reassess periodically to see if maybe they no longer need it, or there might be another medication that can serve that purpose and maybe do something else as well, and kind of work on two different things. So, as people change and their symptoms change, we always need to think about maybe they don't need a medicine anymore.
Okay, so basically polypharmacy just means multiple medications being taken by a person.
Yes.
Okay, very good. So that leads me to my next question, and that is, can taking those multiple medications increase the possibility of somebody falling?
They can. One of the things is, if you're on several medications, if you're on 20 medications, there's a higher chance that one of them may be associated with falls compared to if you're just on 2 medications.
Okay.
So the more medications, the more chances one of them is a risky medication. The other concern is about the combination of medications together. If you have 2 or 3 different medications that can slow your thinking or make you very sleepy, those can kind of add together and really make that much more noticeable than if you were just on one medication with that issue.
Okay. And while we're talking about this, I would assume that there's a risk if somebody's taking a medication and they go, oh, this doesn't make me feel good, then all of a sudden stopping it. Could that cause a fall as well?
You want to be careful stopping medications. Sometimes if you're on a higher dose, people feel better if they kind of slowly go down on the dose to stop, rather than just all of a sudden stopping a higher dose. So I would recommend, to the average person, if a medication is causing you problems and you think you should stop it because the problems are bothering you so much, to talk to your doctor or pharmacist first. They can help you kind of think about, is it really due to that medication? Can we change the dose to maybe make it a little bit easier for them to take? Or would you just stop it, or would you kind of taper it slowly over time? Because stopping all of a sudden sometimes can really cause a big difference that somebody may not be used to the way their body is without the medication.
Okay, this is all mind-boggling to me, and I'm sure it is to our audience as well. But this is great information. So what side effects should the community be aware of that could be potential risk indicators?
I would look for medications that cause you to be tired, sleepy, a little bit foggy or groggy in thinking. Sometimes taking those medications in the evening might be make them a little bit safer than taking them earlier in the day.
Okay.
Anything that kind of makes people unsteady or have a sense of dizziness or spinning, those are other medications I would be really concerned about.
Okay, all right. Now, this next question, it really is weighing heavy on my heart here, because are there certain medications that are riskier when first starting them or changing the dose?
That is a time I would kind of watch out more for changes or potential side effects when starting or when changing the dose. One of the medications that a lot of people take that can be very beneficial are antidepressants. But we see that in the first 2 months or so on those new medications, the risk of fall is a little bit higher, and it comes down, into months 2, 3, and 4. So I would just tell people to be a little bit more cautious. Don't climb on ladders. Don't do unusual events that require more balance during those first couple months till your body gets used to the medications.
Okay. Sometimes people want to go out and celebrate with their families, their birthday, a milestone or something like that. Can mixing alcohol with medications increase a fall?
They potentially can, because alcohol itself can make people unsteady or maybe not thinking quite as clearly. And you put that in combination with a medication that has similar effects, could increase the risk. So people want to be cautious about using alcohol. Be careful, look at the bottle. Sometimes there's a specific sticker that says to avoid alcohol, and I would be more cautious with those medications compared to others.
Okay, all right, great. Can a pharmacist help someone reduce fall risks related to their medications?
If you have a fall or a slip or trip where you catch yourself, it's an important, of course, that you let your doctor know at the next appointment. But also talk to your pharmacist. They can review all of your medications. You want to make sure they know not only about the prescriptions, but over-the-counter vitamins, supplements, herbal medications, and kind of look at them all together to see if any of them are putting you at like a higher falls risk. And then kind of think carefully, how important that medication is. Is there an alternative that's maybe a little bit safer?
Okay. And if somebody has multiple medications and to save time, they take them all at the same time of the day all together, can that cause some issues?
Most of the time you can take most medications together. There's a few things that are best taken separately, like the thyroid medication, like some heartburn medications are usually best first thing in the morning, kind of separated 30 minutes from other medications. There's some thought with some blood pressure, if you're on several blood pressure medicines, it may be helpful to take some in the morning, some in the evening. Generally, taking several medications together is safe, except under special circumstances.
Okay, so it kind of varies person to person. Okay, great. So can we just kind of review some of the simple steps that people can take at home to make sure that they are being that conscientious senior and or caregiver, and make sure that they are really being in tune with what could cause a patient in relation to falls and medications.
I really encourage all people or caregivers of patients to keep a really good up-to-date medication list, to take that with them to all their medical appointments. And then if you think it would be helpful, or if the names of the medications aren't quite as clear and you think more about colors or what the bottle looks like, also take the bottles with you as well, so you can talk to your doctor and pharmacist about the medications, go over them, ask any questions, and it makes it really clear to them what you're taking when they have the list or the bottles that they can look over, because sometimes, as much as we want the computer to be up to date, sometimes there's been a recent change that needs to be updated in the computer.
Okay, great. Well, this information has been very helpful. I've learned a whole lot today, and I'm just really excited that you were willing to take some time. Again, this is Dr. Anne-Marie Nye, and she is over at ECU Monk Geriatrics, among other places, and teaching our younger people of the community who are going into pharmacy medicine. I want to thank you all very much for watching GPAT, and this is Sarah Taylor with ECU Health, Home Health and Hospice, and the Eastern North Carolina Fall Prevention Coalition. Thank you and have a great day.